Assalamu alaikum. My name is Hafsa Khalid and I'm a student of 4th Professional Pharmacy. My roll number is PP1650077 and my group number is 5. So we were assigned the topic of drug abuse for our presentation, and from which I will be discussing drug abuse related to the use of sedatives and hypnotics. The few points that I will be discussing in my presentation are introduction to drug abuse, brief introduction to sedatives and hypnotics, their mechanism of action, their clinical uses, side effects, dependency and withdrawal symptoms, and lastly, I will be presenting a case study for better understanding. So starting with the term drug abuse itself, drug abuse happens when a person uses a drug over and over again and in ways that hurt their health. So the person is using the drug to change their mood or to feel better and not for any health purpose. So this term drug abuse is often misunderstood. It is thought that drug abuse is the adverse effects produced by the drug on the patient. But actually, drug abuse is the overuse or misuse of a drug by the patient himself, which in turn leads to adverse effects. And about the sedatives. Sedatives are substances that induce sedation by reducing irritability or excitement. They are CNS depressants. So basically, they just slow down the whole system. And how do they do so? They do so by making the neurotransmitter GABA work overtime. GABA is short for the neurotransmitter gamma aminobutyric acid, and it is responsible for slowing down the brain. And by upping its level of activity in the CNS, sedatives allow GABA to produce a much stronger effect on our brain activity. And what are hypnotics? Hypnotics or soporific drugs. Soporific is a term used for those drugs which have tendency to induce sleep. So for this reason, hypnotics are commonly known as sleeping pills. And this class of psychoactive drugs is used for the treatment of insomnia and for surgical anesthesia. Here I have some examples of sedatives and hypnotics, which are alprazolam, chloral hydrate, chlordiazepoxide, clorazepate, clonazepam, diazepam, and stazolam. Mechanism of action, as already discussed before, sedatives and hypnotics, they work by increasing the reception of GABA to the GABA receptors. So their effect at these receptors enhances the action of GABA as an inhibitory neurotransmitter and results in the depression of brain activity. Clinical use of sedatives and hypnotics. Sedatives and hypnotics are very commonly prescribed in Pakistan and in fact all over the world for the treatment of anxiety, panic disorders, and especially for the treatment of sleep disorders. Difference between sedatives and hypnotics. These two terms, sedatives and hypnotics, they are very often intermixed and thought to be the same. But actually, there is a very slight difference between sedatives and hypnotics. Sedatives decrease the activity, they moderate the excitement and calms the recipients, whereas hypnotics produce drowsiness and facilitates the onset and maintenance of state of sleep. So the slight difference that occurs between sedatives and hypnotics is that hypnotics, along with slowing down the system, they induce a state of sleep. There are some side effects associated with the use of sedatives and hypnotics, which can be sleepiness, dizziness, blurred vision, not being able to see depth or distance, slower reaction time to things around you, which is impaired reflexes, slower breathing, lesser tendency to feel the pain, having trouble focusing or thinking, speaking more slowly or slurring your words. And if the sedatives and hypnotics are used on long term, then the side effects are a bit more, we can say they are a bit more stronger, and they can lead to the loss of memory, fatigue, feeling of hopelessness, or suicidal thoughts, which are the signs of depression. And other mental health conditions can also be noticed, such as anxiety, and organal dysfunction, such as liver dysfunction or liver failure from tissue damage or overdose, is also possible. Signs of dependency, we know that drugs that produce effect on CNS activity are very much likely to produce dependency. And we can tell that the patient is dependent on those drugs if he cannot stop taking them, or if he feels like he cannot live without taking those drugs, then it is very obvious that the patient is dependent. And second sign of dependency can be that if the patient feels he needs to increase the frequency of intake, or if he needs to increase the dose than the prescribed dose to achieve the desired effect, then it is also obvious that the patient is dependent. Withdrawal symptoms can occur if a patient tries to live without those drugs, or if he tries to quit those drugs, and those withdrawal symptoms can be increased anxiety, irritability, sleeplessness, and restlessness. Now, finally, I have a case study, which is during a year of therapy for anxiety, BJ increased his dose of alprazolam to 2 1 mg tablets 5 times a day. And he has admitted to doctor shopping and buying alprazolam on the street to maintain his daily habit. So will he experience withdrawal symptoms if he suddenly discontinues alprazolam? And how should BJ's sedative hypnotic dependence be treated? So our subjective of this case study is BJ, who is dealing with anxiety and has been on long-term course of therapeutic dose of sedative hypnotics. It is very important to keep in mind that BJ was using sedatives for medicational purposes, that is for the treatment of anxiety, and he has been using it for 1 year. The objective, it is the patient suffers from obvious dependency on sedatives, and it is very much likely that he is now dependent because of the long-term usage, and the withdrawal symptoms that might occur on quitting sedatives present a greater risk of worsening of situation. The situation can get worse if the patient is not able to control the symptoms which might occur on quitting, and the treatment of dependency is very important in this case. So our assessment for this case is that because of long term of usage, it is very much definite that the withdrawal symptoms can occur. And the withdrawal symptoms can be, again, insomnia, agitation, hallucinations, anxiety, and tremors. And because the withdrawal symptoms are linked to the use of a medicine, they can only be medically managed. And again, we know for a fact that short-acting drugs can produce withdrawal symptoms more quickly than long-acting drugs. And in our case, the patient has been using short-acting benzodiazepines. So on withdrawal, abrupt onset of withdrawal symptoms can occur. And the last thing that we can do to control this situation is minimizing the factors that might persuade the patient to ingest sedatives. Example, workload, social issues, and other issues like family issues or anything which can affect him emotionally. So to control the use of drug by the patient, we have to control the environmental factors and other emotional and psychological factors as well. Our plan for the treatment of this withdrawal, we have 3 strategies. First is decreasing dose of the drug of dependence, which is also called tapering. Second is substituting and gradual tapering of a long-acting benzodiazepine for the drug of dependence. As I've mentioned before, long-acting benzodiazepines can have delayed withdrawal symptoms, but not very quick withdrawal symptoms. So it's very much better to use long-acting benzodiazepine in this case. And thirdly, substituting and gradual tapering with phenobarbital. Phenobarbital is the best choice for substitution of benzodiazepines because they have lesser side effects, and also they have delayed withdrawal symptoms. So if now we are recommending the phenobarbital to the patient, it is important that we prescribe the dose on the basis of patient's history and the patient's response to the drug. So after administration of dose, we should keep the patient on observation for at least 2 hours, and we should take notice of everything that a patient feels after administration. And other thing that is important is detoxification. Detoxification is important to get rid of all the toxins that might have occurred during because of overdose. And finally, other thing that we can do is to persuade the patient to go for counseling and for motivational interviewing. So it might help him to um, look into himself and find out all the behavioral changes that he might need to make, and which can help him reduce the factors which that were leading him to use drugs. So concluding my presentation, there are many different types of sedatives that we discussed, and we discussed the difference of sedatives and hypnotics. Benzodiazepines are very popular, especially alprazolam and diazepam. And secondly, because of common availability of sedatives and hypnotics in the market, the patients are very much likely to self-medicate symptoms of underlying depression and anxiety, and this might lead to abuse. Also, misuse or abuse of sedatives may lead to intoxication and can be fatal as well. So, more serious withdrawal is treated by substitution with a long-acting sedative and requires close medical supervision in the outpatient or inpatient setting. This is all for my presentation. I hope that all the points were clear, and I hope that you liked it. Thank you so much.